Okay. The topic that I will discuss today is something that for some years I've been developing, studying and researching. I've been very interested in culture-based bioethics. No? When I say culture-based, it doesn't mean that it's bordering relativism, but it is more of a bioethics that is culturally sensitive. In the Philippines, medicine and healthcare is particularly influenced by Western philosophies and practices. No? Since our healthcare practitioners, doctors and nurses are trained according to Western concepts, procedures, principles and ethics, there seems to be a conflict between local value system and specifically Western conceptions of principles of bioethics. That is why it's been my goal of at least developing in one way or the other some sort of a foundations of Filipino bioethics based on the Filipino value system. One of the things that I've been more interested in Filipino value system was the concept originally proposed by Mercado. This is the loob. Loob is a Filipino term which refers to the core of the personhood of Filipino, that which controls his emotions, behaviors, actions, the way of thinking, perspectives. Loob is different from the self. Loob is something, I may call it the soul, the heart of the soul. That is the origin of the personhood of every Filipino. Now, this loob, as a concept, as a philosophical concept, has been explored by many Filipino philosophers, particularly Mercado, and then you have Diquilla, you have Timbresa, these Filipino philosophers, and of course De Castro, who wrote many things about loob. Now, loob is central to the Filipino value system. We Filipinos, we evaluate our behavior, we evaluate our personhood based on the loob. We call people magandang kalooban if they are good, masamang kalooban if they are evil. That is why we call murderers, rapists, those who do bad to their neighbors as masasama ang loob, or these people who have bad inner identity, bad inner selves or personhood. Even in the way we relate with others, we classify or we normally assess our relationship using the term loob. Say for example, when a thief enters a house and stole something from someone, we say nilooban. No? Somebody entered the house and they stole something from you. We even use the term loob to refer to that. Now, loob is the loob value system has other values attached to it that gives more meaning to loob. First is kapwa. Now, kapwa is our Filipino term for a neighbor, no? Someone other than yourself is always called kapwa. So when you are establishing a good interpersonal relationship with others, we say nakikipagkapwa tao. No? Kapwa is your neighbor. Now, it's more than just a neighbor, but kapwa is considered as somebody who is part of you. Somebody who is part of you. The use of the prefix ka is very important in Filipino ethno-linguistic analysis. The ka is always attached to different words. Say for example, when we say a friend, we can say kaibigan. The ka came from the Filipino term kapwa, which means somebody who is a part of you. When somebody is helping you survive a problem, we call it karamay. Again, the word, the prefix ka is there, which is rooted in the term kapwa. Karamay is somebody who accompanies you in your suffering, somebody who helps you in your pain and in your troubles. Now, in the setting of the hospital in healthcare, karamay is very important concept in Filipino healthcare. We see medical doctors, nurses, healthcare practitioners as karamay in the pain and the suffering of the patient. Karamay meaning kapwa, someone who is a part of you, helping you endure the pain and suffering. So, this pakikipagkapwa, this kapwa, the recognition of the other as part of you is rooted in the bigger concept of loob. Okay? Because once you consider the other as part of you, you share your loob to the other, and the other also shares his or her loob to you. That's more on kapwa. The second more that is aligned with the concept of loob is dangal, which is dignity. No, loob can be destroyed. No, loob can be destroyed by internal or external causes. Say, for example, internal cause. Loob can be destroyed if you lose your self-respect. No? If you lose your self-worth, if you lose a sense of dignity, your loob can be destroyed or can be damaged. A damaged loob will affect your relationship with others, your way of thinking, your behavior, your emotions, and even your worldview and perceptions of reality. Okay? Now, externally, someone can damage your loob if they do something bad to you. No? So, the loob can be tarnished by someone. Say, for example, somebody may influence you to do bad behavior, and that becomes a habit, and it becomes already a practice. Daily, you are doing that bad behavior. You eventually will lose that original goodness of the loob or of the inner being. And because of the loss of that purity of the inner being of the loob, eventually, of course, this will be manifested in your relationship with others. Among healthcare professionals, this is quite obvious. Say, for example, in the Philippines, one can be influenced, a healthcare professional can be influenced to do bad things to a patient by another whose loob is already destroyed or is already affected by external forces. And because of that, their attitude and behavior towards the patient may cause them to injustice, or may cause them to maltreat a patient or disrespect a patient because they lost the sense of loob. Now, as I have said a while ago, loob is related very much to the concept of dangal or dignity. A dignity lost is a damaged loob. A dignity loss is a damaged loob. That is the reason why my idea of a Filipino concept of ethics of healthcare is the ka-loob ethics. I'm anchoring the values of a Filipino healthcare worker to the concept of loob. The different values attached to the loob has been identified by many Filipino researchers, and that's what I'm trying to synthesize, to identify the components of this loob ethics, and eventually create a sort of framework that can guide behavior of a Filipino healthcare worker. Now, the focus is not the procedure, but it is more on the caring part of healthcare. So how must a Filipino behave as a healthcare worker based on his or her unique value system, the uniquely Filipino value system? I examined the Code of Ethics of the Philippine Medical Association and the Philippine Nurses Association. Most of the values and the principles that were contained in those code of conduct are more influenced by principalism. Those principles that were proposed by Childress, Buchan, and the rest of the Western bioethicists. In 2001, Dr. Alora and Dr. Lumitao published a book in Georgetown University. That was in 2001. It's an exploration of Filipino bioethics. a different kind of perspective of bioethics, apart from the Western conception of the principles. And they discovered that among Asians, they are always influenced in their decision making, in the way they treat their patients, in the way they approach their patients. They are always influenced by their values, by their undeniable culture. Not like in principlism, where you are trained to evaluate and assess conditions and situations based on established principles. Now, either you agree with the principle or you disagree with the principle, that'll be their decision. But among Asians, specifically Filipinos, we decide based on values. And I think this is very important today, especially with the influence of internationalization of healthcare, globalization, the challenges of local knowledge economy, the borderless healthcare. In the Philippines, we have medical tourism. More and more foreigners are coming to the Philippines for healthcare. And sometimes they bring with them their own culture, but they are taken care of by Filipinos who also have their own culture. Now, how should a Filipino healthcare worker provide care to international patients without losing their cultural sensitivity as Filipinos? Those are the things that in my research I'm trying to explore. Now, the concept of loob is not purely a philosophical concept. It is also related to psychology, to emotions, to volition, to ethics, okay? And it encompasses everything that we do. It encompasses everything that we do. It's not a new concept. It's been explored in the 1990s, but its application is quite it's not yet established. Especially, it's not even a part of Philippine education curriculum, which is now it interests me the more because today the revised general education curriculum for college students, ethics is a universal course. It's an opportunity for us to integrate Filipino ethics that is values-based as part of that course ethics. So it would be nice if we can integrate the philosophy of loob into the discourse of ethics in Philippines, particularly in application to healthcare and in application to medical procedures or medical protocols. Now, the Kaloob ethics has been proposed. I have presented this to some members of the PMA, the Philippine Med, and they're quite interested in helping us develop the framework because they realize that indeed in medical education in the Philippines, there's not much about the Filipino healthcare value system. We don't have much. Well, because of the fact that we are more Western than any other Asian, not like in other medical courses in Asia. The value system and the culture of the country is integrated in their education. Here, it is only taken in social science courses, but not in a specific disciplinal application of this the value system. So I will be creating the framework, identifying what are the values of the Filipinos that are bioethically relevant, and then construct system where Filipinos can evaluate their behavior in healthcare, where Filipino healthcare workers can assess their performance as Filipino healthcare workers, well, of course, in terms of ethical behavior. And that will be a good contribution to Filipino bioethics. Now, one of the things that they say about enculturating bioethics is relativism, the problem of relativism. Like, for example, if different countries will have different bioethical principles, that would be cultural tyranny. You move to another country, they have different principles, but another country will have another principle. Now, in the United Nations, we know for a fact that UNESCO is made a declaration on bioethics and human rights. and they are trying to create a universal framework for bioethics. That's good. That's good. The only problem is how these principles will be translated into local culture, the local culture. And I think that's the one that I would like to develop here, identifying the ethical principles that are peculiar to a culture, and then looking at the universal principles of ethics, how they correspond, how can they work together, so that the culture of the people, their local wisdom, their ethical mind, their ethical perspectives, ethical orientations will not be suppressed or will not be taken for granted, because we always consider the universal principles, but some sort of a marriage between the two. And I think that will be the component of the one that I'm planning to produce, the Color of Ethics, a Filipino healthcare ethics. A while ago, that one movement of the development of Filipino ethics of healthcare is looking at the universals, bioethics, universal bioethic principles, and how these are related to the Filipino culture and value system. Another movement would be to see how Filipino value system influence the development of these universal bioethical principles. Some of the readings I did on UNESCO documents, especially those that were edited by Professor Dr. Leonardo de Castro, a Filipino who was a representative to the International Bioethics Committee of the UNESCO, is their emphasis on we should not discriminate culture of the local wisdom of different countries. We have to make sure that this rich deposit of local wisdom and ethical principles help in explaining universal principles of ethics. So there can be two movements looking at the universal principles of ethics, how they can correspond to local wisdom or ethical principles, and the other movement will be the local ethical wisdom or principles, how they can enlighten the universal principles of ethics. I think that's a big work. We need to assess the declarations made by IBC or UNESCO, and then check whether they are culturally sensitive. They have what I forgot the name of the author called cultural sensitivity of ethical principles. No? So that can be a different kind of research project that we can add. Moreover, I think one of the things that the problem with local culture influencing universal bioethics principles is how influential is, well, it's more a political question, how influential would be the delegate to the IBC in the debates and the discourse on universal principles of bioethics, whether the delegate was able to assert the local wisdom or the principles of ethics in his own country. But it would be nice to have a deposit of local ethical principles, and then see the universals among them, because definitely there are universals among different principles of ethics from different countries. We have commonalities, and if we are able to identify what is common among all the cultures as principles of ethics, that can be a starting point for a more culturally sensitive principles of bioethics. It's just a matter of documenting them, and then looking at the similarities of the principles coming from different cultures, and then defining them in such a way that they can be inculturated in a different contexts.
So what's the essence of Filipino bioethics? And then among our audience here, I wonder if there's any other suggestions on the essence.
Okay. Well, the the essence of Filipino ethics of healthcare would be, as I have termed it, the ka-loob ethics. I don't know if it is present in other countries, but the concept of kapwa is a beautiful concept among Filipinos. No? Recognizing the other in healthcare, for example, if you recognize your patient as your kapwa, you will never do anything to hurt the patient. You're always thinking of the good of the patient because you see the patient as part of yourself. No? As part of yourself. Whatever you do to the patient, you are doing it to yourself. So it's an extension of yourself. I think that's what is beautiful in the ethical mindset of Filipinos, that we always see the other as the kapwa, as part of our loob. When we help the other, when we help the kapwa, we extend our kalooban to the other. That's why we have a Filipino term, nagmagandang loob, or I extended my loob or my inner self to the other to help the other, no, get a better life, or in the context of healthcare, to recover from any illness. That is why some Filipinos become attached to their patients. When their patients die, they cry. When their patients recover very slow, they are affected, and they will extend, they will do everything. They even sing to their patients just to make them comfortable. If you do that, I remember a case in the United Kingdom, it is not allowed. They even filed a disciplinary case against a Filipino nurse for singing to her patient. And someone complained that she should not be doing that because she's just a nurse, and she was given a disciplinary punishment. But among Filipinos, that's normal. No, that's normal. Sometimes a nurse spends a lot of time, sharing stories with the patient. But in other cultural contexts, that would not be allowed. That would not be allowed. Another one is, one of the policies that we implement in the Philippines is we limit visitors, and even we limit the time. Well, medically speaking, that may be good. But among Filipinos, in times of sickness, it is a community matter. It's a family issue. So they would like to be there resolving the issue. So it would be nice if hospital facilities, they have rooms where families can, gather together, and it helps in the recovery of the patient. But the training is a little bit, not aligned to this cultural practice, so that we limit number of visitors to 1 or 2. Sometimes there are hospitals who doesn't allow visitors at this particular time, blah, blah, blah. But sickness in the Philippines is a community issue. And everyone would like to be involved in the resolution of that or in the cure of that particular sickness.
First question is there, within the Philippine context, is there regional differences between the different ethnic groups within the Philippines that have differences with this bioethics? And on a larger context, is there any similarities within the ASEAN region that are similar to the Philippines in the setting?
Locally, I can speak of the north because I'm more familiar with the region in the north, region 1 and region 2. I think among Ilocanos of the north, they are quite similar in their ethical principles in healthcare, quite similar. The only thing that they believe in that is not allowed in the hospital is traditional healing methods.
Why not?
They don't allow it in the hospitals because the conception, the belief of the hospital that it conflicts with scientific medicine. So sometimes they do it secretly. They consult a faith healer somewhere. They hide whatever is given by the faith healer and then put it under the bed, or have the patient drink the concoction in the evening so that nobody can see, things like this. But we are all similar in that matter. Another that's similar in the north among the Ilocanos of the north when it comes to healthcare is the one that I pointed out a while ago. It's a community issue. The whole barangay, the whole community will get to know it, and each one will have a suggestion on how to cure the sickness of the patient. No? From traditional healing techniques to boiling of leaves and all this stuff. Again, why is it a community? Why is it a community issue? Going back to the general Filipino conception of the Kapwa, because a member of the community is part of myself. So if one member of the community is sick, I am also part of that sickness. I am involved in the sickness. So I'm affected. So I must become part of the eventual healing of the other. So even if they don't visit you in your house, but once you are hospitalized, you see you have so many visitors, especially in the north. Even your relatives who don't, normally come and visit you, when you're at the hospital, they will come with flowers and fruits and food. Even if you cannot eat the food, they will just, offer you food. So because it's a community issue, the Kapwa, that's very dear to Filipinos. We see the other as Kapwa. So if you break the relationship, the Kapwa relationship, you break the affinity, you break the familiar relationship. Although we call if you are not good in pakikipagkapwa-tao, you have masamang loob, bad, what do you call this? You had your how do you call bad, masamang loob in English?
Your inner core is like,
though the connection, the loob that I was explaining, among Filipinos we have a connection, that the loob is our connection to each other. If I do not see the other as a kapwa, I cut that cord that connects us from one another. Okay? So that if I cut my loob relationship with the other becomes kaaway, an enemy. The prefix ka is again there from the word kapwa. So kapwa is gone, you are now my kaaway, you're my enemy. A friend is kaibigan. No? A friend is kaibigan. So I think that's universal among Filipinos in in all the regions, except probably in the south. We know very well that there's Islamic bioethics. The principles are quite different from the principles that we have in this part of the Philippines, because our principles in this part of the Philippines is generally influenced by Christian bioethics. There's Islamic bioethics, which I'm not really familiar with. That's one area of bioethics that I am interested in learning something. No? But on the other side, I am more familiar with the way we relate with each other. Among ASEAN countries, in the book of Mercado, the Filipino Mind, he mentioned that loob the idea of loob is present also among our ASEAN neighbors. We have a word boot among the Malaysians or Indonesians, boot, which is related to loob, the same conception. I remember when I talked about this in Malaysia in 2012, two members of the audience reacted and they say, we also have a concept like that, even in Bangladesh. I remember that doctor, a woman from Bangladesh, said, I forgot to record the word, but she raised her hand and said, we also have a concept similar to that. That would be nice for us to discover also. Okay, and maybe uniquely Asian, who knows? No? So we need other scholars to do related research on this matter. We will not be able to find a common core among Asians in terms of ethics and morality.
I just want to expound more on the context of cultural diversity. Since Sir Marlon mentioned about the South and the North, I would just want to expound more on the context of the urbanized and of the rural area. You mentioned about the beliefs on the hilot, on how about would there be some concerns when it comes to the beliefs of the people from the urbanized area and of the rural area. Like I am from the northern part in Pangasinan. And here we are in Manila, wherein I don't know if they still believe in such.
Yeah, it's a sad reality that people in urban areas like Metro Manila, they lost in one way or the other. Of course, not all. I cannot generalize it. But especially among the young, their rootedness in the value system of Filipinas now. Because more and more, they are oriented towards relativism, towards materialism. These are systems of thought that are, I can say, alien to Filipino culture. No? They are detached from our value system, so that even the simple gesture of respect, they lost it. No? If you go to the provinces, younger people, when they see old people, you see them bow whenever they pass by a group of old people talking. They always bow, and they always say in Filipino, makikiraan po. They ask permission to cross. Here in Manila, no. They bump you, and they don't even care whether you're bumped or not. You know. And don't even say hi and hello. And in the provinces, when you're introduced to old people, they still kiss their hands. Here in Manila, you seldom see that among young people. They just, wave their hands and hi, as if they are of the same age, no? Or the same, or a tap on the shoulder will do. But the kissing of the hands is gone. So I think even in the way we see our patients, I remember I was able to interview a patient in UST when I was still studying there, who came from the province for his treatment in Manila. He came from Antique, far from Manila. And he said, I will heal faster in Antique than here in UST hospital. Why? Because he said, here, I am treated like a patient. In Antique, I'm treated like a family member. So see the difference in approach. Because definitely here in Manila, they'll just visit you and, give you med, change your beddings, check whether you have fever or not, etc., etc. But no, the familial environment that real Filipinos are used to is not there. And it helps in the healing process. It really helps in the healing process. Patients like more visitors. That actually, I myself, when I am at the hospital, I would rather have more visitors than one or two. Please visit me in the hospital. Because the internal, the happiness that is that you gain from friends visiting you, helps your loob to heal faster. Among Filipinos, a sickness is not merely a physical malady. It's a psychological issue. It's a mental problem. It's a spiritual issue. So we see sickness as integrally as one. The body is sick, but it's not only the body, but the whole of you. Even your loob is sick. Saya masama ang loob or mabigat ang kalooban among Filipinos. The idea of loob is always there.
And what's our interconnectedness with other living creatures? Is it the same word or different?
With animals and plants?
Yeah.
I cannot say much about it. That's one area that I am not really familiar with. Probably.
The Hindu spirituality, Hindu.
I have a dog, and I love my dog. No, it's my dog spends more than what I spend, food and taking care of it. But I don't know. There are some Filipinos who eat dog, especially in the mountainous area provinces of the Philippines. So I think the way we treat our other living creatures like animals and trees, I think that's where our differences are. That's where our differences
But
are.
I think in the before pre-Christian era, we were animists, so there was a lot of interconnection with nature. So a lot of it was lost when the Spanish came. So it was a sort of mixing the old and the new, and a little got lost. I think that's from what I understand.
Yes, now I remember. Even sickness sometimes is ascribed to nature. Nature. Sometimes you get healing from, you got sick because you went near a tree, or you get sick because something related to the way
Tree was cut.
you treated with the animals, or a tree was cut. Say a very old and ancient tree was cut, and the spirits living in those trees.
It's common here. Either mass hysteria or
Yes, and then the only way for you to be healed is to offer food or whatever is required by the faith healer or the local shaman. No? I think even with animals, I believe in the north, I still remember my aunt. She used to say that the Ilocanos believe, I don't know if in your province they have this belief, they treat cats differently than dogs. I observed this in some provinces, in some towns in Ilocos Sur. They can hurt the dog, but they are afraid to hurt the cat. Is that the same thing? Yes. Because apparently if they hurt the cat, they will be punished in the next life. They will be punished in the next life. But the dogs. Now I was trying to understand that and relate it to the belief among Filipinos that when there's someone dead in the family, that's dead, there's a cat in the coffin. Put the cat on top of the coffin or under a live cat, to ward off the bad spirit from taking the soul of the person. And that's not only unique to Filipinos. The Egyptians have it. The Egyptians have it. That's one area that I'm actually really interested in trying to find the even in.
But they specialize like the color of the cat or every cat can.
Yes. As long as it is a cat. I don't know. They give higher respect to cats than to dogs, especially in the north.
Because in
We
Thailand,
tie dogs but never cats.
because in Thailand it relate to the people who they just a black cat,
black cat.
Bad cat. Oh,
black cat.
black cat. Here we also have as a belief, superstition. Black cat is not good. Black cat is not good. The same belief, no? The same belief. But that amazes me. The cat symbolism and the recognition of the supernatural power of the cat is quite amazing. No? That's one thing that has not yet been explored in Philippine anthropology or archaeology or whatever discipline it is. No? And I don't know if that applies to a sick person. If there is a cat, will the sick person get well better faster? Those are things that need to be documented, to be researched. Dogs, no, they are not related to his sickness, to death.
Dogs are more west. The
More
care of
Western
dogs
for
is
Filipinos,
Western,
yeah.
We take care of dogs. I'm more close to dogs than cats, so I take care of dogs.
Cats are more relevant culturally to Filipinos than dogs. That is probably the reason why we don't eat cats. Many Filipinos eat dogs. I don't know. There's some sort of a sacredness to the cat among Filipinos. And I was just wondering, if there is a cat in the hospital, will it help? Will it help? Our psychology students at our university experimented on animal therapy to patients in the hospital. One of the animals they use is a cat. And based on their observation, the cat is more tolerant to a sick person than the dog. And yeah, that's one of their observations. And probably because if the cat is so domesticated, they're very quiet and peaceful. You can just put them on top, and then they will just sit there. Purr. That would be a nice area to discover.
Similar in Thailand. So some points from cat is similar in Thailand, because in Thailand we believe we have the belief about the cat like they have. If somebody hit the cat, it's the same here. They will get the punishment from the god, from the and the cat they compare with the young monk in Thailand. It's like if we do something bad for the young monk, the monk, that small monk, what call, still young but be the monk.
So
That they compare with the they compare with the cat. if we do something bad with cat, right? It mean we do.
Last one. About the cat. I don't know why we went to the cat. The relationship to other creatures. In Fuga Island, the one we visited some years ago, there are ancient burial grounds. They bury their dead in a big jar, and then bury them on the ground, facing the sea. Then they put the dead inside the jar. And then one animal that they include is a dead cat. They include a dead cat in the tomb. Yes. So that the cat can protect the soul in its journey towards the afterlife. Now I keep on asking, where did you get that idea?
Egyptian?
Yeah, because in Egyptian, that's basically, and we know for a fact that Filipino mummification is older than Egyptian mummification. So who borrowed what? Yes. Now, so when it comes to our relationship with other creatures, it's quite different per region. It's quite different per region.
What about concepts of autonomy and the relationship to others? So, autonomy?
That's a big problem in healthcare in the Philippines. Sometimes the patient is not the one who decides. It's the family who decides. Or worse, it's the one who is paying the bill who decides. Yeah. I think paternalism is still very, very much practiced in Philippine healthcare. No? The doctor has so much influence in the decision making. And sometimes the doctor decides and the family will just say, you said it, and then it must be okay. So they just follow whatever the doctor is, tells them to do. And yeah.
And in your thesis, so do you plan to have any data?
Yes.
Besides
Yes.
data methodology?
I'll be gathering data from doctors, medical practitioners from Luzon, Visayas, and Mindanao. I have my former students in St. Paul Graduate School in Manila, so I can ask them to help me in gathering data for my paper, so that I will not only have data from Luzon, but I can have data from other regions as well. And just like what I was saying a while ago, there I will be able to identify commonalities among the three regions. And if I can identify the commonalities, it can be used as components of the ethics of Filipino health patient care.
May I add the concept of privacy, where in Western countries privacy is a must. Like I have this private space. There must be a certain space or certain time alone with myself. Whereas in Filipino culture, it's less. It's not that important. Am I right? We are accustomed to living in small spaces, small quarters. Whereas for other cultures, they cannot survive in such an environment where you can have 4 people in a room, for example. So that's one distinct in terms of healthcare. People can, even your extended relatives can make decisions, can look into family decisions. Not within the circle of family, even the lolas, the grandfather, the uncles can barge in within the privacy of the family and contribute in making decisions.
Yeah. Sometimes here, the patient doesn't even know his or her exact condition, but the family members, they know. Okay, that's autonomy, understanding of autonomy. And sometimes the patient will just say, before deciding, he consults the members of the family. He consults, and the doctor can never say anything privately to the patient alone. The family members, they must be there. They must be there. Again, because it's a community issue. It's a family issue. It's not an individual issue. It's not an individual issue. So when the doctor explains the diagnosis, the prognosis, it's not to the patient alone. The members of the family, they must be there. They must be there. Or else they, quarrel with the doctor. And they will express anger and things like this. The doctors, they know it. So, they, even though they were educated in the Western system, they have adjusted to this cultural peculiarities of Filipinos in healthcare.
What about love?
Bioethics is love of life. No?
Bioethics, love of life in the Philippines?
Primarily, love of life is important issue among Filipinos, especially now with the death penalty and all this stuff. Many Filipinos are still against it. Yeah. To the extent that they will sacrifice the future of the members of the family just to get one member of the family the right treatment, the best possible operation, etc., etc., because they will bargain with the hospital or even with God, and they will spend everything, ask their kids to stop studying so that they can spend their resources for the recovery of only one member. That's how they wouldn't like to lose anyone. They wouldn't like to lose life. They really love life. And I think that's when the problem with the issue of justice and issue of what do you call this, the issue of resources, when to stop treatment, okay, when to forgo treatment, when to withdraw, okay, things like this, because they can sacrifice the future of the rest of the family just for the sake of the one who's sick. Even though it's already futile, they will still bargain. So when it comes to pushing the button to stop the life-sustaining machine, it's a struggle. Even though the doctors already said there's no more hope, nothing is there, they will still insist on it. Even though they don't have money to pay for the procedure or for the operation, they insist on having it. Because we value the life of the other. When somebody dies, a part of us dies. And that's a painful experience for Filipinos. Again, going back to the idea of, because the other is part of me. We are connected. Our inner being is connected to one another. And if that relationship is cut, something is lost in me. So as much as possible, I really do anything to preserve the connection.
What about intergenerational connections?
Sorry?
Intergenerational connections or the genealogical connections? You talked about here of the elderly people now, but what about your ancestors or the future generations?
We still don't allow abortion. That affinity, I think, is I cannot give a definite answer to that, but I believe, on my observation, it's also intergenerational, even to the future generation. Even to future generation, so that every parent, everyone still dream of having his or her own baby. Dream of still his or her own baby, and sometimes they decide, for example, to do everything so that their sons and daughters, when they will be the one in that position also of suffering, their sons and daughters will also fight for the life of this of the mother or the father, because they saw them doing that for their parents. So it's something that it's a value that they need to pass on to the next generation.
What about, so for example, adopted children and the genetically related children, were they treated the same in the past?
I don't have any idea. I haven't encountered that in my readings, how adopted children are treated I don't know. Do you have any idea?
I think it's when children are adopted here, they're very
also
well
treat
taken.
them.
Yeah, you treat the same as a child that was born from the natural way. So I think it's the same. If a child was adopted, there's no difference.
Sometimes they are even treated better than the original children. Sometimes. My aunt has an adopted child. I think they treat them fairly the same. Because whenever the adopted child is sick, I see that they attend to that child equally as they attend to their natural children.
Especially for adopted, they never want the adopted children to feel that they're not part of the family. So I think they're even given more love and more care than those children that were born naturally, because of the psychological effect of even a slight hint of being less loved than the children, the natural children, it will affect the adopted child. So I think for most, they will shower care and love for the adopted.
That would be a good area for research, though. A different kind of research.
Thank you very much.
Thank you very much.